Good evening to everyone. Happy to see everyone here today and quite a good number. I'm Dr. Selva Ganapati from the Lions Club of Sramban Central. I'm welcoming everyone to join our this year's first ever in online talk in a special topic. Based on last year, we had the same topic, but it was more an introduction. And this year is more on treatment. So, following in my experience, where I have my special child, and I did a 3 years research, and I found out to be uh, our NeuroGen hospital is giving us tremendous super treatment to not only to the India but all over the countries. So personally, I went there and I found out I gained a lot of knowledge there, and a good response to my boy. So I took this time. Thank you to NeuroGen Hospital and also to our Dr. Nandini especially who take time for us from India. She's giving to share our knowledge to everyone. So Dr. Nandini was like my sister when I was in India. Thank you for your hospitality and everything. And my boy is getting well. And it's a privilege for the Lions Club Sroma Central to welcoming Dr. Nandini to give this talk. And I was being told that we have nearly 65 people is registered, and currently we have 35 coming in. For your information, Doctor, Malaysians, we just finished our works and coming back, so they'll be slow and steady coming in, logging in, and a lot of parents are interested to listen this talk. So I want to share that Dr. Nandini is also our Deputy Director of NeuroGen Hospital, Brain and Spine Institute, and she also did a lot of research, especially on this uh, regenerative medicine. So, and not only that, she has been published a lot of related on this topic in books and also scientific publication. And so I don't want to take a lot of time here, and I'm going to give to Dr. Nandini this floor. And I think people are coming in, and I hope Dr. Nandini, this floor is for you. And for the participant, please ask, can ask how much question you wanted to ask to Dr. Nandini. She will be a very patient and she will be nice to be explained whatever question we are going to ask. So thank you so much again, and I pass to this floor to Dr. Nandini. Thank you, Doctor.
Thank you so much, Dr. Selva, for your kind words. And thank you so much for this invitation to talk on this topic, which is very close to my heart. Thank you to the Rotary Club from Malaysia as well. And welcome to all the participants, all the parents who are looking forward to always finding something new for your children, isn't it? So you keep on looking, scoring the internet. Uh, so you get some information, some right, some wrong, and at some point you want to know directly from the people who are doing it, the experts, what exactly is the reality. So what works, what doesn't. So my endeavor here, my try would be to make things as simple as possible for you and make it understandable and uh, to understand what is simple, what is safe for your children, and to help you make a decision about the various new treatments which are now available. So knowledge is power. So first step is to be aware and to know. And yes, as Dr. Selva said, at the end of my talk, I will take all your questions. Please do put your questions in the question answer box. So the topic today is the recent advances in the treatment of autism, cerebral palsy, and other neurodevelopmental conditions. This is NeuroGen Brain and Spine Institute in a very beautiful place known as Navi Mumbai, which is, you all know about Mumbai and you've heard about the hustle bustle of Mumbai, right? So this is a little away from the main Mumbai. It is a bit of the suburbs and a very well planned city and very beautiful, cathartic, and very therapeutic place. So why are we here? We are here either because we have children who have special needs, um, or we are caretakers of such children, or we are doctors and therapists who work with these children, and we want to know, you know, what is the current situation. What is currently happening is that once a child is diagnosed, or once you figure out there is something wrong with your child or different with your child, you run from pillar to post. You go from one place to another. You visit a lot of doctors. You visit therapists. You go to various clinics, hospitals. You're told only rehabilitation. Keep doing rehabilitation, and you've been told the one thing that you keep on hearing everywhere is there is no cure. There is no medical treatment. And uniformly, this is not just in India or in Malaysia. Wherever I go, and when I ask them, is this what you have been told? And everybody nods their head saying, yes, this is, we have been told that you have to live with this condition throughout life. And the only treatment that you have is rehabilitation. Nothing else is possible. However, I'm here to tell you that this is no more true, that every day, every week, we keep seeing children improve. For the last 15 years, we have seen thousands of children do well. So, what is it that helps you? What is new? And that's what today's seminar is about. We know that the old thinking, very age-old dogma is that the nervous system, the brain, is incapable of regeneration. Isn't that what you have heard? Doctors and laymen alike. There are doctors also in this particular platform, I'm sure, doctors who are parents themselves. Dr. Salva himself is a doctor. And he has a child with special needs. So there are so many other doctors from Malaysia we have treated, from all over the world, whose children have autism or cerebral palsy. And even they believed for a longish time that brain is incapable of regenerating. However, this is no longer true, not just now, but way back in 2003 when I was doing my postdoctoral fellowship on understanding the brain development. At that time itself, it was known, or it was understood, that there are niches in the brain. There are small pockets in the brain which continue to multiply lifelong, and, and they are capable of regeneration. How do we know this? Just imagine that if this was not possible, how would you create new memories? How would you remember what you did yesterday? How would you remember whom you met yesterday? So this happens by the new network and new connection formation. That means brain is quite adaptable. It adapts to newer things, it adapts to newer situation, it learns every day. And this learning is also a process of regeneration and re-networking. And in those who have a brain damage, now it is possible through the process of cellular repair to be able to regenerate and replace the damaged tissue in the brain. So the old view was only rehabilitation is the only thing that can help your child. You keep doing therapy day in and day out, and for years together. You continue to do rehab without sometime even having a roadmap, without knowing your goals, without knowing where are you going to. Every day you take your child from one therapy to another, and what at the end of the day, when you look at what you have achieved, maybe a little bit. So you need a roadmap. You need to understand what more can you do. So the old view is that only rehabilitation was possible. Now the new view is that with rehabilitation, now we have two team members. Why do you need two new team members? Rehabilitation is the experienced one. Yeah. You have a team which is doing all right, which is doing fine, but can't win the World Cup. Right. So you need to find new team members which will add on strength, which will add on new energy to your rehabilitation team. So to this rehabilitation team, now today we are adding two new team members. The first team member is the cellular therapy. The other team member is the integrative therapies or oxygen-based therapies. So these are the two new members I'm going to introduce, and we are going to see when you integrate all of these three, what happens? What magic can we create? So now we know that along with neurorehabilitation, when we do cellular therapy and when we do integrative therapy, what can we do? We can reverse autism and cerebral palsy, right? I know it is sometimes you must be thinking that what I'm saying doesn't sound really True, but when we were long time back, when we were playing cricket for a long time, and for we did not believe that we could win the World Cup, but it was possible with a combination team where there was old blood and new blood together, old experienced players with new experienced players, and with a new insight and with a new confidence, it was possible to achieve the unthinkable. We have been able to achieve this. It is possible to reverse autism using a combination, this winning combination. So, how does this work? What really do we need to do? What we need to do is repair. You can see here something which we take for granted in if there is a fractured feet, fracture of the foot. What will you do? Will you start walking once the fracture, when you see a fracture in the x-ray? Will you put weight on your leg? No. You will first repair the bone, either putting a plaster or by putting a splint, surgically repairing it. And once the bone heals, then you put pressure on the leg. Then you do exercise. Imagine if you start walking on a fractured leg, what will happen? Your fracture will worsen. Similarly, that's what is happening when your brain is damaged. You can see in the first picture here that the blue part is the damaged brain. The blue part is a low functioning brain. And in this brain is what we are doing the rehabilitation right now. So you are walking on a fractured leg. Here you are doing therapy training on a low functioning brain. And when you do this, when you push your child to do more than he can do, more than his capacity, he rebels. That's where you see the tantrums, then you see the hyperactivity, the aggressiveness, because you're making the child do something which he is not capable of doing. His brain is not capable of doing. So now, after this, you can see on the right side, you can see a brain repaired. You can see green parts of the brain which are now activated. And this is the brain. Now you do the training. Now you do the therapy. You will start seeing improvement in the child who was unable to perform earlier, who was unable to understand what you're trying to teach him, will now start learning better because now the brain is healed. Now the foundation is strong, and once this foundation is strong, then you can now build a taller building. So that's the concept of regenerative medicine. That's the concept of getting from wheelchair to walking, from getting a child who is unable to do his own activity to be able to go to school and study. So the first team member which I'm introducing to you is a cellular therapy or cell therapy, and many of you know it as stem cell therapy. So what is actually a cell therapy? Like a cell is like a stem cell is like a stem of a tree, and when you give water and fertilizer, it gives rise to branches and leaves and flowers and fruits. Correct. So it's important to give water and fertilizer to the stem. So the cells that we put need to be nurtured, need to be trained to be able to convert them into different type of tissue in our body. If you put the cells in the muscles, they will form muscle cells. If you put them in the liver, they form liver cells. If you put them in the brain, they help form the brain cells. So how do they work? What do they actually do, these cells? These cells have the capability of multiplying many, many times. So one cell can become thousands of cells. Okay, that is one thing. The other thing is these cells can improve blood supply in the brain. So when the blood supply increases, more oxygen reaches the brain, thereby helping the brain to repair better. These also release growth factors, positive chemicals, which will again promote the process of healing and repairing. Finally, the cells then become the neurons, or if you put them in the liver cells. So I'm going to talk about brain now. So these cells now, in about a couple of months, will convert into new neurons, then start connecting to the process of rehabilitation. So this is what the stem cells do. They repair, regenerate, and replace the damaged tissue. And this is the promising, very exciting field of regenerative medicine. To regenerate what is damaged, to regenerate what is lost, and regenerate what is working less. So you can see the brain here. You can see the blue part is the low functioning or damaged part. The green and yellow is good functioning brain. And as the stem cells go there, they go and stimulate the damaged part of the brain, and you can see that the dark blue has become light blue and the light blue has become green. That means now these cells are getting activated and ready to take in information and work. Now, depending on where you take these cells from and where you put them, you can either have an autologous transplantation or you can have an allogenic transplantation. Autologous meaning take from my own body, put it back where I require. That's called autologous. Allogenic means take from somebody else and put into my body. So that is a donor cell. So where do you get these cells from? Can you go to a shop and buy these cells? Not yet. Maybe the stem cells you have heard of, which you can order online on Amazon, these are not animal cells. These are plant-based cells. They have antioxidant properties. These are made from apple or grapes. So I'm not talking about those stem cells. I'm talking about human stem cells. Where do we get these from? So at one point of time, all of us were stem cells in our body. We came from our mother's womb where these cells grew and became the whole child. So when from the embryo's time, if we culture these cells, they can form any type of cell in our body. These are known as embryonic stem cell. However, in view of religious contention or even some medical issues, these cells cannot be used for treatment. Because in some religions, it is understood that life starts at conception, and we are killing an embryo if we are using an embryo to create cells. So embryonic stem cells cannot be used for treatment. The other major source of stem cell is the cord blood. Cord blood is something all of us know that it can be stored. When the child is born, this cord is cut and either put into the dustbin and wasted, or we can store the blood from this at minus 190 degrees centigrade, cryopreserved in certain banks. Okay, so these cells are a very strong, have a lot of cells, stem cells, and can be used for blood disorders like sickle cell anemia, thalassemia, blood cancer. In these conditions, this is indicated very well. So if we don't have embryonic stem cell and we don't have cord blood stem cells, what do we have? We do have adult stem cells in our body which continue to multiply and form different kind of cells. For example, we have bone marrow which keeps on producing blood. We have fat tissue which produces adipose cells. So these are also very good source of stem cells and can be used without any fear of tumors. And they are also, there are no ethical issues because you're not killing an embryo. So for brain conditions, when you need to repair the brain, but your bone marrow is fine, your skin is fine, other organs are okay, we can use the child's own bone marrow because it is healthy. There is nothing wrong in this bone marrow. There are no rejection issues. It is simple to take, and we are not killing an embryo, and hence bone marrow from the child's own body can be used as a source of stem cells to repair the brain damage. Okay, so these are different main source cells from the bone marrow are feasible and potentially can be used. So at NeuroGen Brain and Spine Institute, we did a lot of research on what type of cell should be used, where does the safety lie, and we found that use of bone marrow cells is safe. There are no long-term side effects. There is no rejection issue, no tumor formation. They're easily obtainable using a very thin needle. There is no cut, no stitch, and there are no ethical issues. We are not killing an embryo. So a lot of research has gone into the field of stem cells for the last 40 years, and there are 3 Nobel Prizes which have been awarded for this research in the world. At NeuroGen, we have done a lot of work, as Dr. Selva said, that we have published over 100 plus publications, scientific publications in various journals, national and international peer-reviewed journals. And we have the maximum publication in autism. We were the first in the world to publish a scientific paper on autism, showing that bone marrow cells can be used to improve brain function. We have also, in view of our experience and credibility and our experience as well as our leadership in the field of stem cells and autism and other neurodevelopmental condition, we have been invited to write book chapters on recent advances in autism, where we wrote a chapter on stem cell therapy in autism. We have written a book chapter in a book known as Cerebral Palsy Challenges for the Future. We have written a chapter on stem cell therapy for cerebral palsy. We have written a chapter, we have been invited to write a chapter in a book known as Physical Disability Therapeutic Implication, a book on muscular dystrophy. This is our Honorable Prime Minister Shri Narendra Modi, who again is a visionary and has a lot of support, has given a lot of support for stem cell research. Professor Dr. Alok Sharma, who's a neurosurgeon and director of our institute, is presenting the book that we have written to the Prime Minister. So when our Prime Minister took power in 2014, he went and met the Nobel laureate, Professor Yamanaka, who works in Japan on induced pluripotent stem cells. He went and understood this technology and brought it back and what is going on in Bangalore. He talked about this visit in the parliament as well. I'm just showing you a clip too. He also has written a preface for a book that we have written on muscular dystrophy and translated in the language of his state, that is Gujarat. So he's written this preface for the chapter on
मैं जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट यामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So what he's saying is that I went to Japan and I understood the process of stem cells, and I believe and I feel and I appeal to the youth, the scientists of India to do research on stem cells. So very, very strong appeal in the parliament, which is very rare in terms of any health issues being taken up in parliament, and that too by the Prime Minister, is a big, big word of support for us. Now, how is the treatment done? How is this treatment done at NeuroGen Vein and Spine Institute? We believe that the problem is in the brain and that we have to reach the brain. And it's important that we choose cells which are safe. So as I told you, the safety of cells taken from the bone marrow is well established. And that the bone marrow has a large capacity to regenerate and repair is also well established. The first ever Nobel Prize was awarded to the discovery of stem cells in the bone marrow. So bone marrow is taken from the hip bone in the front using a very, very thin needle, as you can see. The bone marrow is like a thick blood. It is aspirated. And then the separation happens in the laboratory in the hospital itself next to the operation theater. And these cells separated are injected in the lower back into the spinal fluid. And these cells reach the brain and help improve the brain functioning. Now, let's just have a look at this video, which actually shows how so this is bone marrow. Bone marrow is aspirated in the laboratory. It is being processed and then checked, counted, and then injected using, you can see, very thin needle in the back, very thin. So why the spinal fluid? We inject the cells in the lower back in the spinal fluid because, as I said, we believe that the cells need to reach the brain. Now, there are three ways that this treatment or these cells can be transferred or transplanted. The first way, the most simplest, is giving it intravenously into the IV fluids. When we give intravenously, these cells have to traverse a very long route from the IV blood here to the right side of the heart. The right side of the heart pumps the blood, it goes to the lungs. And in the lungs, it gets filtered, it comes back oxygenated into the left part of the heart, and then from the heart gets pumped to various parts of the body. So half of the cells get trapped in the lungs, the other half will get diluted to all different parts, will go to the liver, to the lungs, to the intestine, to the heart, and maybe a few to the brain. So giving intravenous, yes, it is safe. Infusions are safe relatively. However, efficiency is very, very low. The other way that we can inject is directly into the brain. When you inject directly into the brain, you are likely to reach to the concerned area faster and more directly. So efficiency may be low, however, risks are thereby high because you are going directly to the brain. You may damage the part of the brain which is not damaged. Hence, we came to a middle path. We went into the lower back, into the spinal fluid. This fluid goes all around the brain and spine, and it stimulates. It will go directly to the brain. So if I have a target, I need to go directly rather than via, right? So this helps the cells without any cut, without any stitches, without damaging the brain to reach the brain. So hence we found that going intrathecally into the spinal fluid is the easiest, simplest, most efficient way of reaching the cells to the brain. So this is a process. So let's look at some of the results that we have had. In autism, we know what autism is. Autism has main three issues: communication, social interaction, and repetitive behavior. It's a neurodevelopmental disorder, and it is a spectrum disorder. That means some people are mild, some are very severe, and some are in between. And why do we need to know about this, or why do you need to find definitive treatment for this? Because the numbers are increasing exponentially, alarmingly in epidemic proportion. If you see here, 2004, the numbers were 1 in 166. Okay. In 2006, the prevalence was 1 in 150. And now the prevalence is 1 in 36. The recent 2023 CDC Atlanta data tells us that the numbers are huge, and maybe in the next few years, maybe it will be just 1 in 3. So that what does that mean? That means that we need to, one, understand the causes, but we also need to find definitive treatment to be able to help the child to integrate into the community better and faster. We can't keep on waiting and waiting for some very 100% treatment to come, and by the time the child is 15 years old, it's already too late by then. 70 million people in the world are on the spectrum, 1% of the world's population. So the main problem is poor social interaction, impaired communication, and restricted repetitive behavior. Now, these are things we know. What is it that we know better and more? And what is the new treatment? How does it help? So what we know better is we have understood the pathophysiology of autism better. We've understood what happens in the brain better. We may not know how it happens or why it happens, but we definitely know what happens. So when we say what happens, we have done a lot of study on brain imaging, neuroimaging. We look at the brain to understand what is wrong. So everybody knows about this imaging, that is MRI. MRI tells us about the structure of the brain. 90 to 95% of the time, the structure is fine. What is problem is the functioning of the brain. So here you are seeing a PET scan. Here you are seeing the brain from the side view. The blue part is functioning less. The darker the blue, lesser the function. So these are the areas which are functioning less. The green, yellow, and red is functioning all right. Okay. Now the areas which are functioning less, what are you seeing here? Understanding. Hippocampus is about understanding, learning, memory, comprehension. Is that affected in your child? Think about it. The amygdala is about social interaction or socialization and emotional expression. Number 2. Number 3, cerebellum is for fine motor activity, coordination, balance, articulation. Okay, sensory processing. Thalamus for motor and sensory processing as well. So these are the areas generally we find are functioning less. And this work of ours is published in the World Journal of Nuclear Medicine. And what we saw very interestingly was that when you look at the trajectory of how the brain develops or how the brain functioning increases in a neurotypical child, you will see that this blue line indicates a neurotypical child. You will see that the brain functioning is increasing fast up till 10. Between 10 to 15, it increases, albeit a bit slowly. Okay, so blue is a neurotypical brain functioning. The orange indicates low functioning. Orange indicates autism, And as you see, initially in autism, the brain functioning is high, metabolism is high, but with time it keeps on going down and down. So what we can see with age, the gap between a neurotypical and a neurodiverse or autistic brain, the gap is more and more and more. So if we have to do anything and get the best result, you have to work fast. You have to work when the gap is less. The more the gap, the more difficult and more energy you have to utilize to push this graph up. So the treatment that we do, the cell therapy, helps to push this graph up towards more typical brain. So what is the management of autism? There is no one-stop shop. There is no one arrow. What we need is a multi-tasking team, a multifaceted team, which will do a lot of things. So we need a multi-pronged approach. We need therapy. You need rehabilitation. You need occupational therapy, ABA, physical therapy, speech therapy. All of this is required. And to this, when we add the cellular therapy or hyperbaric oxygen, you find complementary results. So having a holistic and comprehensive approach is the key. The neurorehabilitation, all of us know, is the experience base of autism. It is the solid structure on which a lot of treatment is based on. So what are we doing to this structure or pillar? We are adding a new pillar to make the base strong. Neurorehabilitation, of course, you need to have ABA or psychological cognitive therapy. You need physiotherapy. Okay, you need occupational therapy, sensory integration therapy. We also need speech therapy, aquatic therapy. Aquatic therapy, children love water, so playing in water helps the child to learn faster. Art-based therapy, music therapy. Many people do chelation to get rid of the heavy metals. So for our treatment, that is not required. Supplements, vitamin supplements also form a big part because many times children are picky eater. But be careful when you are giving the supplements. Diet and nutrition plays an important role. Diet and nutrition, generally the suggestion is avoid refined sugar because that increases hyperactivity in a child. Avoid a lot of junk food as well as soft drinks or aerated drinks. Give more organic food, give more vegetables. If you can try gluten-free and casein-free diet, that is advisable. Unless it is affecting your child's nutrition, you can try gluten-free, casein-free diet. It helps to reduce a lot of the gas or the gut issues. Digestion becomes better. So the results of the cell therapy, the first ever publication came in 2013, where we published a series in the Stem Cells International Journal. So here we found that the brain functioning improves in children. You can see the PET scan before the treatment and after. The damage is reduced. Okay, this is before the treatment and after. You can see that there is a distinct improvement in the brain functioning. Here you can see that over a period of time, the damage is reduced. The blue part, in 6 months, it has reduced. And then further 6 months, it has reduced much further. So the brain function is progressively reducing. But when we are doing only rehabilitation, is it enough? It doesn't really repair the brain damage. As you saw earlier, the brain damage is reduced only by cellular therapy. So in the first ever publication, what did we see? We looked at 32 patients and we found that using the child's own cells, injecting into the spinal fluid helps give significant improvement in overall the child's development and in the Indian scale for autism assessment, which has various domains, and all the domains there is significant improvement. The second publication came from the American Journal of Stem Cell in 2020. So this showed about data of 254 patients where we found that symptoms improved. First of all, which symptoms? First is hyperactivity reduced, understanding improved, eye contact improved, attention and focus improved, aggressiveness became lesser, self-injurious behavior became lesser, sitting tolerance is better, command following, communication, verbal as well as non-verbal improves. Based on the severity, we found that both mild, moderate improved well. We have found that children who come to us less than 5 years have almost a 97 to 98% success rate. That means out of 100 children that we treat who are less than 5 years, 97 to 98 will improve. Between 5 to 10 years, about 90 to 94 will improve. Between 10 to 15 years, 90% will improve, 85 to 90. So as the age increases, the possibility of success is reduced by 5%. Based on when the treatment was done, if you take the treatment within a year of the child's diagnosis, almost 100% children will do well. Between 1 to 5 years, the possibility of success goes to 95. Above 5 years, possibility goes to 92%. So the publications, there is a lot of work happening all over the world. 3 of the publications came from India. The first ever from India, the second from China, third from Italy, fourth from US, sixth from India, then Vietnam, Iran, US, and again recently this month itself we have published. We have sent for publication data of 1,011 patients, which is there on Google Scholar. So these are all our publications. Let's look at a few improvement examples. This is a child who is now 19 years old, who came to us when he was 11 years. So this is an 8 years follow-up. The first time, he's from the US. His father is an interventional cardiologist. Mother was a nurse. And the first time he came in 2015 for the first treatment, December. Then he came in 2017 for the second treatment and the third treatment in 2018. So over a period of 3 years, we found that he came out of autism. What were his problems? His problems were he had fleeting eye contact, he had low self-awareness, he had no sensory issues, he had a lot of sensory issues, he had a lot of stereotypical behavior. He would not wear full hand shirt or full pants or even sneakers because he could not tolerate those clothes. He had a lot of aggressive and kicking behavior, a lot of temper tantrums, hyperactivity, poor command following. Within 5 months, what the mother noticed was that his reading level went from 3rd grade 4th month to a 7th grade 1 month reading level. So that was the academic improvement that was seen within 5 months. Eye contact improved, temper tantrums reduced. He started looking or exploring new food. His sensory issues reduced. He started brushing his teeth and he started wearing full hands, full clothes. Understanding cognition, memory, attention span improved. Socialization improved. He started playing with other kids, better emotional expression. He could ride a cycle. His brain functioning also showed good improvement. In the classroom, when he was first time when he came, he was in a special class in a normal school, and then he got integrated into the regular school, and he got A in all the subjects, most of the subjects. This is his report card. And his GPA was 3.833, just close to the 4, which is the highest. So a child who was mild autism, 26.5 is a autism scar scale, and who came to be diagnosed, had no autism in 2017. And by 18, he was completely out of autism with maybe a few ADHD symptoms. And this is him at the age of 19. He passed out, graduated from grade 12. He applied for a lot of colleges. He went on a trip to Ireland and England, and he sings and he can speak Spanish and English. This is his journey, where the mother is speaking.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So this is Ganesh's story. There are many more stories I would like to talk to you about.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. Send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
For what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
friends ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So this was almost 5-6 years back. Now these children are 11 years old, strapping males. One of them, who was mild, is now out of autism. He plays beautiful piano. They were in India for some time, and this child, he learned the Indian national anthem. Okay, and he can play the Indian national anthem beautifully. The second, who was moderate, is now in mild. And the one who was severe is now towards moderate and actually has started speaking as well. So even though they are triplets, each one of them was different. Each one responded differently, and all of them are slowly and steadily improving over the last few years. So this were the triplets from Kenya. This is now a child again from Kenya who was 13 years old when he came to us, extremely severely hyperactive. Practically for 13 years he was inside his home because he was not allowed to go to school. He was extremely aggressive and hyperactive. The cell therapy, he calmed down. Hyperactivity reduced, his attention improved. He could sit in one place, he could do various activities which was not possible earlier. He cooperated during speech therapy. He started saying a few words like, "How are you?" If you ask him, he said, "I'm fine." He finishes the activities, puts it back. Social behavior and socialization improved. He started swimming and enjoying it, and he also started cycling. Okay, which was not possible for him to focus and do for a long time. This is another child who came to us from South Africa when he was 4 years old, and then at 5 years. You can see the first time when he came, he's completely listless. He will not support for any kind of therapy. But in a year, this changes. He could sit, he could do various activities, asked for things, he could respond. He started completing his tasks, his understanding improved, he started verbalizing, started having few words which are relevant and focused. This was important. So this was a year that at least his brain started functioning and responding to rehabilitation and therapies. Problem solving improved. He could do more puzzles. So this was in a year. So in a year, we saw this progress after the first treatment. After the second treatment, so the first was in 2018, first was in 2017, second in 2018, and then in November 2020. So almost 3 to 4 years after the cell therapy, the mother sends me this message with a video of the same child. He was practically non-verbal when he came to us. Now see this video which he has made by himself, and he is making a story by himself.
Once upon a time, Pete the cat was walking down the street and his brain knew white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes, I love my white shoes, I love my white shoes. Oh no. Pete stands in a large pile of strawberries. What color did it turn his shoes? Red. Did Pete gray? Goodness, no. He kept walking along and singing his song. I love my red shoes, I love my red shoes, I love my red shoes. Oh no! Pete stands in a large pile of blueberries. What color did it turn his shoes?
3-minute video, so I'm going to let you all go and just, it's so beautiful just hearing Zach talk. This is a child from India, 8 years old. He had, difficult, he needed assistance for obstacle crossing. Sorry, after the treatment, he could do it fast. Physical prompts were used. He could getting good attention. He could do things much better. He didn't get distracted very easily. This is before and on the other side is after the treatment. Eye contact became better, attention improves, sitting tolerance becomes better, learning better. Now you can teach the child so many things. Motor tolerance. There are children who would not brush have started brushing. Children who would not chew have started chewing and trying out different food. Sensory issues reduce. Child learns beautifully, comprehension, understanding improves, motor functions improve. So there's so many changes that you see after the treatment. So it was about autism. Now we look about results in cerebral palsy. In cerebral palsy, we know that there is severe brain damage due to either problem during pregnancy or during labor or shortly after birth, and depending on the parts of the brain which are damaged, either you get one part of the body is not functional or paralyzed, or you have lower parts is paralyzed or neck down paralyzed, or even cognition is gone sometimes. This is you can see the scan, which is very severe damage. The black part is dead, the blue part is functioning less, and that can be recovered or salvaged. The general treatment is either medications for controlling seizures or fits, or medication for reducing tightness, or Botox or injections. Or if the tightness is too much, then you may need to do a tendon release or a surgery, or there can be a very critical surgery known as dorsal rhizotomy, which helps reduce the tightness. But nothing really helps the brain functioning from improving from inside. And clinical cell therapy really helps the brain functioning from inside. So this is a data of 262 patients, and where we see that oromotor improves, speech improves from the center to down, sitting balance improves, standing and walking, ambulation, leg movements improve, muscle tone becomes better, the cognition improves. So this is in a paraplegic CP, and a quadriplegic CP again, oromotor and chewing, swallowing, cognition, neck holding first. And only if neck holding comes, then sitting balance and walking will happen later. We also see improvement in the statistical scores, and we see improvement in the brain functioning. So these are a few brain scans you can see here. You can see above is before the treatment. This is the blue part which is damaged. Before the treatment, you can see after that the blue has become green. So the brain activity has improved. You can see the middle part known as the thalamus is green, but very little green, and a lot of around it is still not developed. In 6 months, you can see that the green part is developed much better. Again, you can see the thalamus properly not developed. Even you can see here what is called the basal ganglia. So this, like a peacock-like place, and also the butterfly area. All these now have developed after the treatment. Also the cerebral, the small brain at the back, is starting to work better. You can see big chunk of the brain was not working. All these, green part is now blue. So the blue means the brain is active, and now you can do the training and connect and get physical as well as cognitive improvement. So the difference is that only with the rehabilitation you get some improvement. With cell therapy rehabilitation, the cell therapy stimulates the rehabilitation stimulates the cell therapy, and they work synergistically or complementary. These are our publications. A few examples. This is a case of a 7-year-old child from West Bengal who came to us in 2020, January. Next time in November 2021. When he came to us first, he was GMFCS 4. 4 means 5 is the most severe and 1 is the least severe. 4 would be somewhere near the most severe. So he was 4 in severity. He had hardly any balance. He was not able to sit independently. He needed support to sit. He needed support. He couldn't stand, couldn't walk. He didn't have high coordination. He could not speak. He was homeschooled. So after the treatment, in over a period of 22 months, the child was unable to sit was now able to sit after 7 years. Okay, he was able to sit with support, and he was able to stand with support, and then walk with a walker. Child was unable to speak, is now making sentences. The child who could not go to school because of physical limitation now started going to school. And his coordination improved, his hand manipulation, balance improved, clinical scores all improved. This is brain scan. You can see before the treatment, there was so much blue area. You can see the difference in the brain. And after the treatment, in about 22 months, you can see the brain is completely active. So that is the difference, that the brain is now alive and active. Okay. This is another child whose brain you can see in 2016. See how the brain was. You can't see the lower part. Okay, this is 16, and after 32 months, look at the brain. Just look at how the brain is functioning has improved. This is the child. Yeah, the child was completely had no neck control. So he needs to be pulled. After the treatment, slowly you could see that he's giving support to pulling up. He's able to go on all fours. He's able to sit with lesser support. When earlier he would totally give up his body control, no body control earlier. Now sitting and using his hands better. Earlier he needed complete support, and slowly the support became standing needed lesser support. And then when drug control improved and training for walking started, this happened over a period of 2 years. But every treatment with rehabilitation pushed the child to the next step. There's another child from Kenya who came to us when he was 7-year-old who could not stand at all. This is full supported standing he is doing right now. After the treatment, in 6 months to a year, we trained him to walk with walker. First, he started walking with walker, and then he started walking without support. And now at home, he walks without support outside the home. Another child from Kenya who came to us at 14 years of age. He was a quadriplegic. He was wheelchair bound when he came to us. His hand functions were also low. Cognitively, he was good. After the treatment, you can see sitting balance, wearing his own clothes. He had not learned this in 14 years. After the cell therapy, within a month, he learned to wear his own clothes. He learned to use his hands. He learned to use the phone. He learned to open the bottle. So all these functional needs were attained in a month. And then they continued to do therapy. And within a couple of years, you can see that a child who was completely wheelchair bound is now walking without support. The child whose case report we have seen before, you can see that before there was no rolling, and after that, you can see before so much support is required after the treatment. You can see that he is now sitting without support. Earlier, he could not even stand. Now he stands without support, with minimal support, and he could walk with walker. So he is, of course, trying, but he is attempting to walk. That's most important. So these are a few examples of cerebral palsy. A little bit about intellectual disability. Sometimes cerebral palsy accompanies intellectual disability and vice versa. And even in autism, sometimes you see intellectual disability. So again, the brain functioning here is affected. Though there is no definitive treatment apart from cell therapy, medications help behaviors or hyperactivity can reduce with medication. Only rehabilitation was the core earlier. So we looked at this, we did a comparison study. So here we looked at cell therapy with rehabilitation itself and rehabilitation alone. And first time ever in the world, this was published by NeuroGen. So we looked at 58 patients, 29 doing only rehabilitation and 29 doing cell therapy with rehabilitation. So this comparison really speaks for itself what together cell therapy and rehabilitation can do. Here you can see this graph. The blue graph indicates intervention group, that means cell therapy group, and the orange indicates only rehabilitation group. So you can see here in only rehabilitation, 20% of the individuals did not show any improvement, 80% showed improvement. So that's a good result, right? For only rehabilitation. However, see the difference in what kind of improvement that you get. With cell therapy, there were no patients without improvement. All of them improved. The difference is that with only rehabilitation, you get only mainly mild improvements. Few improvements you get, like 37% of the individuals showed only mild improvements, while 13% only showed significant improvements. While with cellular therapy or stem cell therapy, maximum 62% of the children or individuals showed significant improvements. So that's a qualitative improvement that you see. So this is a brain scan before the treatment. In the, you can see the whole brain is shrunk. All these blue areas are working less, and after the treatment, you can see a whole lot of that improvement seen or damage is repaired. This is our publications again. So there are a lot of examples for this was a child, a young man of 20 years who came to us, right? He came to us twice, 19, 20, and 21. His social age was 9 years. He could not read, he could not write, he could not play physically with other children, he could not speak full sentences. Mathematics was a big issue, social behavior was affected. He could not go out independently, he could not do grocery shopping. And over a period of 2 years, his reading and writing skills improved. He was able to do mathematical calculation almost till 1,000 independently. He was able to go buy groceries, help his father in the shop. His social interaction improved. He could converse with his peers. His speech as well as improved. His confidence improved. He was able to cook omelette and dosa on his own. This was the difference, even in a 20-year-old child, so individual. So just imagine if a child comes early, how much more improvement that can we do. Down syndrome again. Down syndrome also we do see improvement, though it is a chromosomal condition. And we know that there could be a cardiac issue, or there could be thyroid problem, or there could be hernia. But all this, of course, need their own different kind of treatment. If there's a heart problem, you need to get a cardiothoracic surgeon to operate on the child. But all of this get corrected. But somewhere the brain functioning it doesn't get improved. And with the cell therapy, we're able to improve the brain functioning, so that the child's intelligent quotient improves, the child's physical abilities as well as cognitive ability improves. And we can see a few examples here. This is a 12-year-old girl who came to us, who was going to special school earlier. She had a lot of body tone issues. So her body tone was very low, motor power was very low, though she was walking and all. She started climbing those rails. She started solving puzzles on her own. Her understanding improved. She started writing. She started learning the Sunday, Monday, weeks, days of the week. She started helping at home. Motor jumping improved. Speech clarity improved. You will see her speech was absolutely unclear earlier. Helping at home improved. Motor planning, motor balance improved. Now she can dance. She can cook at home. She makes tea at home.
5. Yes.
This was 5 before the.
Yes. 5. Yes. 2, 3, 4.
You can see that her speech clarity has improved. So this was about neurodevelopmental conditions. I have not covered adult conditions in this because it would have become very long. I'm happy to do another webinar for that. Now, in terms of complications, because of course, yes, treatment is safe. It is simple. You can see the effects. It is simple and effective. But are there any complications? That is one of the major worries of the parents. Now, there are no major adverse events because we are taking a child's own cells. There is no irreversible neurological deterioration. There can be a few short-term minor complications or parallel effects. One is a spinal headache, because of the procedure. 10% of children can have this headache. It can last for 3 to 4 days. But out of 100, only 10. Now, in those who have a history of seizure or whose EEG is abnormal, 3 to 6% may show a transient increase in the epilepsy or convulsion rate, and medications can be upgraded to control them. Now, the third team member which I spoke to you about was integrative and oxygen-based therapy. I'm going to in short tell you about what is this. we keep on trying to see what more can we do to enhance the results of the cell therapy or to improve the brain functioning. And we found that hyperbaric oxygen and ozone therapy works very well, beautifully, when done in combination with the cell therapy. Of its own also they work, but combination works better. So in hyperbaric oxygen therapy, what happens? We are giving increased 100% oxygen at increasing pressure. So when we are breathing normal air, we are breathing 20% oxygen at 1 atmosphere pressure. At that time, the oxygen is going only into the red blood cells. You'll see here. So here you can see that the oxygen at normal pressure is going only into the red blood cells. There is no oxygen here in the fluid medium, right? At increasing pressure, the pressure increases from 1.3 to 1.5 to 1.7. More oxygen diffuses into the plasma. So you get a lot of oxygen flushed into the bloodstream. And as the oxygen is flushed into the bloodstream, the whole body is flushed with oxygen right from here to the toe. So now we have increased oxygenation, and oxygen is a life-giving molecule, right? And it improves the functioning of the cells. It helps survive for the cells to survive better, and it also helps the cells to survive better what we have put in. So hyperbaric oxygen helps to improve immunity. It stimulates oxygenation. It improves metabolism. It increases energy levels. It reduces fatigue, and it improves overall functioning. So along with cell therapy, when we add on hyperbaric oxygen therapy, we are able to improve the results of the cell therapy. Now, ozone is another form of oxygenation. Ozone is a modification of oxygen. Oxygen we know are two atoms, right? 1 and 2. 1 and 2, this is oxygen. But when we add one more, which is a bit unstable, this is an activated form of oxygen known as ozone or O3. So O2 becomes O3, and this is an activated oxygen. And activated oxygen has a lot of positive effects. It is a germicide. It kills bacteria, viruses, fungus we don't want in our body. It reduces swelling and inflammation. It reduces blood clots. Clots make the blood thinner. So more blood flows into our body. It acts as an antioxidant. So this combination of oxygen and ozone is very helpful. Also in improving gut health. So we can give it like an enema to the child, and the gut becomes cleansed completely. Okay, the third is mobilization or the deep tissue mobilization or acupressure. Helps to stimulate various points in our body, and also it helps induces a state of relaxation and relief. Helps to soothe or calm the child as well. So vitamin supplementation can be done. Now this is what we are now. What I told you is about along with rehabilitation, cellular therapy, and integrative therapy. This is done at NeuroGen Brain and Spine Institute, Navi Mumbai, as I said, and I welcome you all. We have treated over 13,000 patients from 75 different countries, including Malaysia. And this is our core team, which is a very experienced team of the neurosurgeon, Dr. Alok Sharma, is the director, myself, Dr. Jacob, who's a neurorehabilitation expert and one of the most senior physiotherapists in the country. Dr. Prerna Bade is the head of regenerative laboratory, and Dr. Himangi Sane is the head of research. This is our infrastructure where all the patients come and stay. We're near a beautiful lake. A lot of flamingos we see during the flamingo season. Operation theatre, where the procedure is done, and just next to the operation theatre is a stem cell laboratory where the cell separation is done. This is the stay all in one place with comprehensive neurorehabilitation under one roof, multidisciplinary approach, including all therapies, including aquatic therapy. So what does therapy do? Stem cell is like a stem of a tree, and the growth factors are the rehabilitation and the oxygen-based therapy. All this together helps the cells to grow and multiply and become what they finally are destined to become. So this is a physiotherapy unit where we don't have a lot of machines, but we believe in one-on-one healing, and hand touch is very important for a patient's healing. Occupational therapy or occupational rehabilitation. Autism Child Development Center, which is made very friendly for the child, colorful. Spinal cord injury walking track for adult patients, especially to help them and train them to walk better. Sensory integration therapy. Lot of activities of daily living teaching, speech therapy, arts therapy, dance therapy, all of this. And along with that, we have written a lot of books which are all available online for both parents and professionals. We are accredited ISO and GLP GMP certified. We have been also awarded a lot of awards, both national as well as international. This is the European Award, Rosa Paracelsus Award, Women Association and Best Medical Practice. For disability, work on disability as well. So this is our website. You can reach us at www.neurogenbsi.com, and we will get back to you. Some of my colleagues will set up a Skype interview or a WhatsApp interview, and each a patient has a coordinator who will help you with the logistics here. We have two types of treatment plans, 1 week program and a 2 week. In 1 week, we have an arrival on a particular day, that is Sunday. Monday is the assessment and blood workup. Look at the brain functioning as well as on brain imaging are done on Monday. Then the Tuesday is the day of the cell therapy procedure, which is just a 1-day procedure, followed by rehabilitation from Wednesday to Saturday. The second week, the 2 weeks basically contains a combination of the cell therapy and rehabilitation with integrative therapy, a 10-day therapy. So there are a lot of places which are doing cell therapy. And why are we different? What is different in NeuroGen? What is different in NeuroGen is that NeuroGen focuses only on neurological conditions. So we do not treat liver or diabetes or heart. Because Dr. Sharma, our director, is a neurosurgeon. Our focus is only on neurological condition. We have done a lot of research on neurological condition. We have the largest number of publications in the world, 106 to 107 publications in the world. Our international, we have international book chapters in different books. We have been invited to write chapters. We are the only therapy centers which treats only exclusively neurological condition. We use safe cells that are stem cells from the patient's own body, which are injected into the spinal fluid. We combine cell therapy with comprehensive neurorehabilitation and integrative therapies, and we have treated over 13,000 patients from 75 different countries. Now we have a combination of very senior, experienced professionals who monitor everything, and we keep doing a lot of research on what new options can we treat. And we are the only center who has their government-approved ethics committee which monitors all our work. So in conclusion, adult cell therapy is safe. It is effective for autism, cerebral palsy, and other neurodevelopmental conditions. And this helps to improve the functioning of the individual since there are no other definitive treatment options available. So I hope this webinar has been able to bring a ray of hope in your life. It's very important, I believe, for everybody to have a hope, to get up next day in the morning and to function. So this was our endeavor, our try to get you to think positively, that there is a way ahead for your child. And that's very important because all is not lost and there are a lot of possibilities.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So I always like to finish with this very, very promising and positive speech by President Barack Obama, where there are two messages which we get. One, that the thing in people's mind is that this treatment or this research is banned in the US, which is not so. This ban was overcome in 2008. However, the ban was only on embryonic stem cell research, so not on adult stem cells. In the time that no research happened in the US, a lot of work happened here in Southeast Asia, in our region. That's one thing. And what he promises, I think we have already delivered. That, slowly that word of incurable and terminal, from especially for neurological condition, we have been able to slowly and steadily, we are reversing it. So thank you again, Dr. Selva and the Lions Club of Cerebral Central for this beautiful invitation, and so happy to see so many participants coming in despite weekday today. Happy to hand over to Dr. Selva and happy to answer questions as well.
Yes, thank you so much, Dr. Nandini. And I hope everyone had benefited. And I saw like we have a few questions in online. I hope Dr. Nandini can be able to answer first at all.
Sure. So I'll be taking these questions. So one parent has asked, can the parent be the donor marrow? As I understand, own DNA stem cells are more effective. The patient's own cells are better. When you take from parents also, even if they are parent, they are not 100% the same, right? So there are possibility of rejection and you go into a different kind of a complication. So since we are dealing with brain functioning issues, the bone marrow is fine. We test for that. We do blood test, which ensures that the bone marrow is adequate and it is healthy. So we do not need even the parent's bone marrow. In fact, children's bone marrow is much better than adult bone marrow. So we can use the child's own cells. It's better for the child. The second question is from Shanti. ADHD and autism together for 4 years completed boy. How to control this? So autism many a time coexists with ADHD. And both, if you look at it, arises from the brain. So both, even ADHD is like a minor form of autism, where it's more issues of hyperactivity and attention concentration. So the problem is in the brain. And one thing is, yes, a lot of rehabilitation therapy, sports activities will help to control, and cell therapy in addition will help to improve the main issue in the brain. And along with that, when you do rehabilitation, the child, especially for a 4-year-old child, there is a lot of promise. So my suggestion is to try cell therapy earlier rather than later. Please provide video and slides. Yes, you will be getting all the information and recorded video on your email, Shanti. So do not worry. Manvi says, if my club will promote Autism Awareness Month, what is the best way to make the, what did he say? Make the ribbon red, yellow, blue to be worn during April. I'm not sure what.
What she means is, she wants in April is the Autism Awareness Month. So what color of ribbon should be suitable for us to wear to make the awareness of month?
Oh, so the autism, there are autism colors, isn't it? So I would suggest that if you have to, you can make those autism color, or you can make a ribbon with all the colors in it. So you can make that puzzle colors, isn't it? So you have this autism colors together, they form a puzzle, and you can make a ribbon of that.
Oh, that means it's like a 7 colors together, something like that.
There are 4 colors. 4 colors of autism, yeah. So together would give a better impact.
What is the 4 colors, doctor?
So I think it's yellow, light blue, dark blue, and red.
Right, yellow.
Yeah.
Okay. Yeah. I think the line money will got that.
Yeah.
Okay.
So will harvesting stem cells from pelvic bone at a pediatric age group affect growth plate adversely? Absolutely not. No. Absolutely not. This is from the iliac crest. So the growth plate is at the joints. So no, harvesting from the pelvic bone from the iliac crest does not affect the growth plate. We have been doing for 15 years, and in fact, physically the children grow beautifully. There is no issue. I'm a mother of a 4-year, 3-month-old toddler with speech delay, able to say a few words, can sing rhymes and understand instruction. He's attending regular kindergarten. I would like to know if the stem cell treatment pricing and which part of India I can go to seek this treatment. So since the name is not there, if you could just put your name. Anyway, we will be reaching out to you, and my colleague Mariam will be able to help you guide logistics. We are in Mumbai, in Navi Mumbai, in India, and we will connect with you about the other logistics. And yes, I think cell therapy at this age would work wonderfully for your child. How frequent do they have to do this treatment? Now, it depends on how severe the problem is and what is the age of the child. So we do a detailed assessment, understand what is the severity of the child clinically, and look at the PET scan, and together then we can give an answer whether one treatment is enough or 2 or 3 may be required. Even if the treatment has to be given, we have to wait for 6 months to see the difference, and second treatment will be done after 6 months. So if required, over a period of 2 years, maybe 3, but every child, it is different. We need to understand the child's condition and brain scan, and then we can give you an answer. What are the complications and side effects? I did speak about it, Ratna. The cell therapy, different types of cell therapy, depending on which cells you use from. We are taking from the child's own bone marrow, hence absolutely safe, no long-term side effects. Only those who have a history of seizure may have transient increase in seizure in 3 to 6% cases. So out of 100, 3. If stem cells come from child who is having a problem, wouldn't stem cells be defective? No. Your child is grown, is eating, is running, right? So why the bone marrow is not a problem, right? We are taking the bone marrow, the blood forming cells. These cells are absolutely fine unless the child has sickle cell anemia, thalassemia, or any fever or infection. In fever or infection, we need the fever or infection to first settle down, and then we do the treatment. So by and large, the bone marrow, which produces blood till we die, is active, functional, and very much can be used for the same child whose problem is in the brain. The problem is not in the bone marrow. Lalija saying, thank you for your comprehensive, clear presentation. I'm a psychiatrist. This is regarding ASD. Yes, Dr. Lalija, I think it's your questions, right? Are there any contraindications to these procedures? The contraindications, there are some absolute and some relative contraindication. Absolute contraindications are, since we are taking from the child's own bone marrow, so no viral infections, no communicable diseases, no history of cancer or tumors. The relative contraindications are if the child has temporary fever, that needs to be okay. The liver function and kidney function all has to be fine. If there are uncontrolled seizures, then further seizures need to settle. Otherwise, there are no major contraindications. How many treatments required? I did tell in every child it is different. So we start with 1, see how the child does in 6 months. Depending on the brain scan, may think of another treatment after 6 to 8 months. What investigations are done prior to the procedure? 1, we do a complete blood workup. We do routine preoperative blood tests like CBC, the hemoglobin, all the 3 triple markers. We do liver function test, kidney function test, sugars, electrolytes, G6PD, B12, vitamin D. That is more for our post-treatment medications. So this is basically thyroid, TSH. We do brain scans, we do an MRI and a PET-CT scan, and we do EEG. So these are routinely the tests which are done for autism. For cerebral palsy, if the child is unambulatory, we may do a hip X-ray and all. But you are asking for autism, right? Thank you. You're from Nepal and there is no therapy at all. I understand, Shanti, there is no therapy. But what we suggest then is the following. We do therapy here at NeuroGen. we give the video to the parents, we give a home program, and we suggest that you do whatever best you can do at your level. We have seen many children improve with therapies done by mothers, but it is more possible when the child is younger. As the child grows, then you need professional help for sure. Can we keep the problem of our baby crew speaking? So yes, Shanti, we will get in touch with you, and we will ensure that your questions are answered on a one-on-one. So Mariam, please ensure that Shanti gets to connect with me or one of the doctors so that her queries can be answered. The Shivanandan, yes, recording will be available. Yes, to all those who have registered and whose email IDs are with us, you will get an email. What are the good prognosis factors? Understand from presentation, age, severity. Yes, age is the predominant, I feel, prognostication factor. The earlier the child comes, better. No comorbidities like hearing or visual issues. If hearing or visual issues are there, then the prognosis is lesser. If seizures are there, uncontrolled seizures, again the prognosis is lesser. So a child younger than 5 has the best result, yes, and good rehabilitation after the therapy.
Okay. Dr. Nandini, thank you so much. I have one question. This is
Sure.
from my club members who had the same situation like my side. One of the family member had the child age of 11. Another family have age of, if I'm not mistaken, 18 to 20. So is it our procedure, the stem cell, and after that, the therapy can help them for 11 years old boy and the 18, 20 years old boy?
Yes, yes, certainly. So if you remember, I showed a video of an 11-year-old boy from the US, and he's doing beautifully. So it all depends on what kind of rehab has happened so far, what is the level of the child now, and what kind of rehab you do after the treatment. So all that will decide how much the improvement will be. See, we have done treatment even up to 25 and 30 years. Okay. It's not that improvement doesn't happen. Improvement will happen. But of course, then at that time we look at realistic expectations. We set goals for the child based on the level, and then we work on that child. So every child is different, and if the parents are motivated and they know what they want and they work towards it, it is possible to help these children also.
Okay. Thank you so much, Doctor. So I think one more last question, then we can close our section.
I think I have only one question. Mr.
Yes,
Lakshman
one more
Shri,
last question.
any role in MRI division tensor imaging in pre and post procedure evaluation? So we do MRI DTI before the treatment. If you look at the MRI DTI regularly reported by routine radiologists, it generally comes as normal. So since MRI broadly seems to be normal prognostication, that's why we went on to PET scan, because PET scan gives us more cellular resolution at the level of cell metabolism. That's why we use that as a prognostication. For MRI tensor imaging, first you will need to find the defect. Now, interestingly, we still looked at the MRI. We do MRI routinely, and in order for research and academic interest, our researchers did much more detailed assessment of the MRI and did find that there is affectation of the corpus callosum. Development of the corpus callosum is delayed. Certain parts is delayed in autism. However, routine MRI reporting does not pick it up. It has to go through a very different churning research software to be able to get that information. So we will be eventually looking at whether we can do any prognostication. Right now, we have done a cohort study, a group, but individual patient, whether we can, extrapolate and understand, where the corpus callosum is, we still need to do some more research. So what it means is that the resolution of MRI DTI is not enough to pick up problem on an individual basis and prognosticate, and hence the PET scan. The other option would be a resting functional MRI, which is still a research tool and not yet validated for autism. I hope that answers your question, Dr. Lakshman. Yeah.
Okay, Dr. Nandini, thank you so much for your time.
Thank you so much, Dr. Salva.
I hope everyone has benefited, and I'm so happy that around 45 participants came down.
Yeah. Yes, quite a few.
That's good, and happy for it. And very soon in December, I will come back for my boy for second round of treatment. So
Looking
hope
forward to.
so I'll be sharing your knowledge to other members more.
Most welcome. So we will be sharing the video of this to all the participants, and we will one of my colleagues will be connecting with them, and if they need to connect with any of us, any of our doctors, she will connect with us. So your questions, if still unanswered, will get answered. So have a good weekend. Have a great weekend, and again, thank you, Dr. Salva, for organizing this and ensuring that this happens so well. And again, thank you for the Lions Club of Cerebral Central. Thank you so much.
Thank you, Dr. Nandini. See you.
See you. Have a great day.